Hello everyone, hope you're doing well. This is a supplemental video for this module's information, today's healthcare environment. And I'm of course recording this in 2025, but there are a lot of challenges that we're going through in healthcare today that I thought would be important to recognize and talk about. So from that perspective, when we think about healthcare today, finances are a really, really big struggle, and that's been the case all the way since COVID in 2020. If you'll remember back in 2019, and we were pretty stable in healthcare. There were some challenges, of course, with staffing and such, but once 2020 hit, there was a lot of inflation that really impacted healthcare, and that came from really salary and wages, and the fact that many units had to divert and of course put people into ICU beds and such. So a lot of hospitals diverted their workforce to controlling the COVID-19 pandemic. And part of that challenge is, we should have had, in some capacity in the United States, enough equipment, of course, to make sure that we could withstand a global health catastrophe, which we found out pretty quickly that we didn't. And that was a challenge due to the fact that we had to ship a lot of things in, and that took time, respirator units and such. But one thing that I'll point out during the COVID time period was, you had a lot of people that were in the healthcare workforce that went through some challenging times and completely dropped out. So they burned out and they didn't come back. So healthcare staffing currently is it's not as low as it was in the last 2 years, but historically, when you look at studies recently, it is quite low. So people have dropped out of the healthcare workforce, and I do think this will increase over time. But that's one of the many challenges that we're dealing with. So based on that challenge, many organizations have done everything they can to pay healthcare workers more than what is standard. So inflation had a lot to do with that, of course, but we've had to pay nurses and medical assistants, techs, quite a bit more than we at time had budgeted, just due to the fact that there was not very many out there in the market, and we needed them to run our facilities. So that's been a challenge. So I wanted to share that, and just wanted you to think about it as future healthcare people in the marketplace, that a lot of times healthcare follows the challenges of the economic times that we're in, and we're definitely seeing that today. So healthcare staffing continues to be an issue. So that's what I was wanting to talk about a little bit from the perspective of sharing my screen. These are just a few different things that came up when I typed in healthcare environment today. So I thought that was interesting. Another thing I wanted to share with you really quickly, I think is going to be interesting. One second. An article from the American Medical Association, AMA. So physicians and non-physicians, what are the differences? There are not enough physicians, MDs and DOs, currently in the U.S. to serve the growing population of needs in healthcare that we have. So I say that by saying, there's a lot of challenges with not just, education for physicians, the cost of it, how long it takes, but also residency. So, we have some physicians, MDs, DOs, that'll get out of residency and $300,000 to $400,000. So that's an issue within itself, which has led to, of course, less and less people going into the medical field from a physician's standpoint. It takes a long time. It takes you, I think, 8 to 12 years, depending on what kind of specialty you want to go in. But I say that to say, a really interesting thing that started to pop up over the last couple of years, even more since COVID, is non-physicians in their treatment of patients. You saw APPs and APPs are nurse practitioners, physicians assistants, involved in healthcare pretty heavily in the last few years, but you're starting to see that more. And the time it takes for, as an example, a nurse practitioner to get their education and to start seeing patients on the ambulatory side or potentially around on the hospital side is much less than what you would receive from a physician who has to go through residency and such. Now, there is a high need for physicians. I'm not saying that we don't need physicians in the hospital or the ambulatory setting. We do, but having them supplemented with APPs is a good thing, and I think we're going to continue to see that more often. So nurse practitioners who, of course, got their nursing license and then went on to get their master's in nursing within this state. In some states, it required a doctorate. You're going to see that quite a bit more often. We have actually the organization that I work for employs quite a bit of APPs, and they're great additions to the team, and they work alongside physicians pretty closely, which is a really, really great thing. So, there's kind of a sense out there that you have to have physicians, and physicians are the only way to go, and that I think is moving in a different direction now. I think we have to be more of a team and think about things from the perspective of how we're going to care for the patients that are in need, rather than only having a few doctors on staff. So that's moving along. I'm not saying that there's not a place for physicians. You have to have surgeons, right? You have to have certain levels of experience in your OR or in your hospital setting, but hopefully, as we continue to supplement non-physicians, we're going to see a better outcome for healthcare objectives in the U.S. moving forward. I want to share one last thing to talk about today's healthcare environment, and then I'll let you guys get into more information related to your actual textbook. This is from the New York Times. I don't normally share this type of data because it's not scholarly by any means, but it's just a reference to how expensive healthcare is today. Medicare costs continues to skyrocket, and there's a number of different reasons for this. The main reason being the baby boomer population continues to age, and people age, they need healthcare more, right? I think the peak for the baby boomer population age in healthcare needs is 2040. So we're going to see healthcare costs continue to skyrocket until 2040. That places a lot of burden on the federal deficit. It places a lot of burden on federal resources. So I think the mindset, hopefully here pretty soon, of healthcare operations is going to shift from fee-for-service to population health and how to keep the baby boomer population and everyone else that we serve healthy. So you see a lot of organizations, especially in California, Southern California, moving to value-based healthcare, where they, when someone has insurance, the insurance company works with the organization to give a flat fee. So they pay a healthcare organization, say, $3,000 per individual, and that $3,000 lumped together, if you have thousands of people that you take care of, that's your annual budget. And that annual budget, you have to keep people out of the hospital because that's where your greatest cost is. So from that consideration, I think we're moving in that direction because of the cost of healthcare moving in the wrong direction for us. And we have to, of course, take care of the people that have contributed, of course, for many, many years into Medicare taxes and, have paid their fair share over their lifetime. So the question should be not considering the cost, but how do we keep these people healthy? And I think a lot of this will be surrounding how do we keep them out of the ED, making sure they have primary care providers and follow-up, making sure they, of course, are taking care of themselves from a healthy life perspective, giving them the resources they need to stay healthy, eat healthy, all that type of things. So I think you're going to see this moving forward because that's the only direction that we can go. It's going to be challenging over the next few years, but I wanted to share that information with you. And I know I talked a lot about different subjects here, but this is your second lecture, or your first lecture actually. Your second one's going to be more on the textbook side of things. But I wanted to share a little bit about 2025 and my thoughts, some of the challenges that we're seeing in healthcare today, and hopefully this helps you really gauge interest moving forward and some of the challenges that we have, but also knowing that you are a part of the solution. So whatever happens in healthcare moving forward, we need bright people like you guys to help lead the charge to change things for the better. And I think based on the efforts that you're giving in this class, you're going to do that. So if you need anything from me, don't hesitate to reach out. And I look forward to hearing what your thoughts are regarding this lecture and the next one that you're going to watch. Thanks so much.